Good morning, everybody. I'm pleased to say our rates of testing have really increased in New South Wales. In the last 24 hours, we completed more than 7,200 tests, and out of all of those tests, there were 7 new cases, which is, given the number of tests we conducted, a good result. But I do also want to stress today that I'm very pleased to announce New South Wales is now saying to anybody across the state, if you have symptoms, if you're worried you have the COVID-19, if you've been in contact with anyone and you're concerned you have the disease, please come forward and get tested. We're increasing the testing to include everybody across the state, not just those who work with vulnerable people, not just those who live in those high-risk areas where we've had clusters, but anybody across our state who has symptoms, who's concerned they might have it, who's been in contact with someone who's had it, and especially those who work with vulnerable communities or in close contact with many people, please come forward and get tested. We want to see the number of tests go up above 8,000 every day. So we really want to boost our testing, because as we consider lifting restrictions, we have to have more tests, we have to have more people come forward, and we really want that to happen. Can I also say to people, please do not worry about it being a weekend. We often see a dip in the number of tests we're doing on the weekends, but that doesn't need to be the case. If you want to come forward on a Saturday or a Sunday, please do so. We want to keep that rate of testing equal every day to make sure we capture as many people as possible, because the more people that get tested, the less likelihood of the spread, because we can identify those who've actually got the virus, identify their contacts and ask them all to go into isolation. And that's why it's so important for everybody or anybody who has symptoms to please come forward and get tested, even if it happens to be on a weekend. We don't want to see the dips over the weekends that we've seen in the last few weeks. We want to make sure we've got at least 8,000 or so tests a day. We're really ramping it up. We have the capacity now to do that, so please come forward and get tested. As I said, we've used this time during restrictions when we've seen a drop in the number of new cases to prepare our health system, to prepare the community for what will occur if we did raise those restrictions, because we know once more people have contact with each other, the number of cases will go up, the number of people who need a hospital will go up, and that's why we've been preparing our system during this time. As I've reported to you already, we've already doubled our intensive care capacity for beds and for ventilators. We're looking to triple and quadruple that as we go through the next few months and beyond, and this is critical to our strategy, because if we are going to lift restrictions as we want to, we know the consequences of that will be more people coming into contact with each other, and it means more cases and more people who'll need that hospital care. And that's why we've been using this time to prepare our system and prepare all the things we need, like hand sanitisers and equipment, to prepare the community for the future. And again, can I stress, please come forward and get tested if you're worried you have it. It's really, really important for us to get our testing rates up. We have some of the highest testing rates in the world, New South Wales, and I'm very proud of that. I want to commend everybody who started that testing very early. We started from around Australia Day getting our systems in place, and really that high level of testing has helped us reduce the number of new cases and bought us time. We've actually been able to buy time to get our testing right. I also want to again acknowledge that tomorrow, Anzac Day, will be very different, and want to encourage everybody at home to watch the Dawn service live stream from Canberra, but to also be involved in the New South Wales service that starts at 10 a.m. As a tribute to our servicemen and women past and present. And as I said a few days ago, this year more than ever, we can appreciate their sacrifices from generations ago and appreciate what that means and appreciate the significance of remembering Anzac Day more than ever. So I want to encourage everybody to participate, to make sure that we respect and remember those that lost their lives, those that fought for our nation, those that continue to serve in order to protect the liberties we have in this wonderful country. And I also wanted to stress today that we are keeping jobs going in New South Wales. Yesterday I was with the Transport Minister and we talked about the tens of thousands of jobs that we're keeping going and also accelerating. A lot of projects that are currently underway, we're accelerating, getting done faster, bringing forward to really keep those jobs going, because we appreciate that the prospect of a job lost combined with the stress of what we're all going through can put pressure on people in terms of mental health, and that's why I'm really pleased to say that I'm joined today by Minister Bronnie Taylor, who's our Minister for Mental Health. The New South Wales Government is contributing an extra $73 million to extend the mental health services we have, and so please do not be shy or do not be backward in coming forward if you do need help. Minister Taylor will talk about some of the new things we're introducing. It'll involve an extra 180 staff across the state to support those most vulnerable, because those of you who might have a condition might be exacerbated under these circumstances, or else you just might need support for your family or someone to talk to. And it might mean that you're going through a change of life in these difficult circumstances and need support, whether it's having a child or whether it's going through a life change at this time. We know the pressures on mental health are more severe than ever, and Minister Taylor will talk about some of those initiatives we're doing. But can I again thank all of you and say the New South Wales Government is considering what we can do moving forward to ease everybody's stress that you're going through. And part of that strategy is increasing the number of testing, making that more available to everybody across the state, but also making all of us aware that if we do consider going forward in the future with lifting restrictions, we also have to be prepared to practice social isolation, because we know that once you start lifting restrictions, the number of cases will go up and more people will need hospitals. But that's why we've bought ourselves good time in New South Wales. We've bought ourselves good time in preparing our health system and preparing our other institutions for what the next few months might look like. I'll now ask Dr. Chant to give her daily report, then Commissioner Fuller will give his update, and then Minister Taylor will expand on the mental health announcement I foreshadowed this morning. Thank you.
That's where we leave.